To appreciate how far Renee Coley from Sioux Falls has come to be able to do this is to understand how badly it hurt to move her right arm and head at all before her August 2011 rotator cuff repair surgery.
And I couldn't turn my neck to look for traffic.
Renee had a torn rotator cuff tendon, and that's where the muscle and tendon were torn off of the bone and pulled away. The rotator cuff is what allows you to move the shoulder and lift it up and gives you strength. It's also very painful when it's torn.
We watched as surgeon Dr. Eric Peterson at Core Orthopedics of Air Medical Group arthroscopically repaired her torn rotator cuff inside a specially lit operating room in the Avera Surgery Center.
In surgery, I used an arthroscopic, minimally invasive technique where we went in through some small poke holes or keyholes and arthroscopically repaired the tendon back down to her bone.
Dr. Peterson says the difference in long-term results between traditional open rotator cuff repair surgery, where they cut your shoulder open, versus an arthroscopic repair has shown to have similar outcomes. It's the short term that's got patients like Renee sold.
Well, I don't have any pain. I can, reach up in the cupboard and take down dishes, and I used to drop them and break them.
In the short and medium term, I think her recovery and rehabilitation is much accelerated. It was fun to watch her go through the progress.
Recovery doesn't come without hard work, though. Renee went to physical therapy at Core Orthopedics weekly from September through January, and she did rehab exercises at home.
I think she's doing excellent. It's certainly a long recovery. 90% of the recovery is done in the first 3 months, but then she spends the next year getting that last 10% back, and that's predominantly just the strength and endurance in her muscles.
I probably had the best doctor I could have had, really, because everybody else seems to want to cut, and you don't have to go through that.
Renee thinks Dr. Peterson is head and shoulders above other surgeons because just a short 7 months after surgery, she can freely and painlessly now move her arms above her head and shoulders. With your Avera Medical Minute, I'm Nancy Nate Brown, KSFI News.